Looking to scan your patient's unloaded foot with SAM? Here's how you can do it. First, select the Foot Unloaded protocol. Ensure you're set to scan the correct foot. The left foot is selected by default. Then press the Scan button. First, have your patient sit with their leg lying straight on a flat raised surface to stabilize their foot. Scan the plantar surface of the foot. Move your device all the way from the right to the left side of the foot until the ankle is fully scanned. Slowly move up to the heel, rotating your device as you scan it. Finally, lower your device to scan the toes. Remember, keep an eye on this colored icon as you go to ensure you're scanning at the right distance. After about 30 seconds, tap or say stop to complete and review your scan.